Welcome to trimester 2 mobility practice. In this mobility practice, we are going to be focusing on all of our major body joints, starting with a full spinal warm-up, and then we're going to be focusing on shoulders and neck, moving it down into our thoracic region of our spine, so this area right here, and then we're going to come down into our hips and a little bit into our pelvic region as well. So mobility is super important during pregnancy because you really want to have those joints working well, but this means that we want to have kind of equal parts of strength and flexibility because our body is becoming a little extra lax. Our ligaments are a little more lax because of all of the relaxin that's moving through our body, that new hormone that accompanies pregnancy. We want to make sure we're treating our joints with extra love and attention, extra care, so we don't have common pregnancy symptoms like SPD or pubic symphysis disorder, like PGP or pelvic girdle pain, like SI joint problems, like back problems, like round ligament pain, and a mobility practice is part of that. So we will use a few props for this practice. We are going to use either a chair or a stability ball or an exercise ball or a birthing ball. If you don't have a ball, a chair will work just fine. We are going to be using a strap. If you don't have a strap, a long belt or scarf that has some tension in it and doesn't easily move will work just fine. We will be using a yoga block. If you don't have a yoga block, something that's about this thick and this size will work just fine. And lastly, we'll use a rolled up hand towel. So just a hand towel that you would find in your bathroom, roll it up nice and tight so it's like a little burrito, and that's what we'll use for our pelvic practice. And finally, you don't have to have a yoga mat, but if you know that your knee joints, your shins, and your ankles need a little extra support, you can unroll a mat on top of a rug, and that should give those knees and shins a little bit of extra support. Most of what we're going to do today can also be done in your bed if you need even more cushion. And we will try and do almost all of our movements seated, or if we're going to be doing some standing movements, which we are, I will also offer a chair version. So it's nice to have that chair if you find some days it's just really not accessible to do some of these things either on the ground or standing up. So grab it and have it nearby. All right. So we're going to begin. I have a nice thick rug under me, so I'm not going to roll out my mat today, but we will begin in a tabletop posture or quadruped posture. So for that, it is just knees a little bit wider than hips. So you usually hear in traditional yoga classes, knees under hips. While we're pregnant, let's take them just a little wider. Hands not directly, so another cue that you usually hear is wrists under elbows, elbows under shoulders, but during pregnancy I slide my hands out a little bit so we have a little more of an angle and no direct pressure on our wrists. A little tiny bend in the elbows, a bend in your knees, and we're going to start with our full spinal warm-up. So these are cat-cow circles. So if you've ever seen cat-cows before, it looks like a wave of your spine as you roll up and down. Now, if this feels like this is where you want to stay with this movement, you can. What I like to do to take it a little bit deeper or a little more fun, in my personal opinion, is to add some circles into it. So you're still kind of rolling your spine like a wave, but you're also adding some circles. And you can get as creative with this movement as you want. It does not have to look like what I'm doing. It can look like your own version of this, but we're all working on finding a lot of mobility in our spine from our tailbone up to our neck. So lots of freedom of movement, freedom of expression. Very nice. And then we're going to go right into barrel rolls. And what barrel rolls look like are your abdomen drops down and circles around. So you want to imagine if you have paint on the sides of your ribs here, you're painting the inside of a barrel. So imagine you crawl inside a barrel, You've got paint all the way down your sides, and you're trying to paint the entire inside of the barrel with your side rib cage. Very nice. Generous bends in your elbows as you come down, and then we'll reverse that movement. And I'm going to open my knees just a little wider because I found that was a little tricky with them to do as close together as they were. And so we take the movement in the opposite direction. Very nice. All right. So let's see what we've got. Oh, one more before we move on to our shoulders. So this is child's reach. With child's reach, you can keep those knees nice and wide, big toes together, and we're gonna walk our hands out really far and then over to our left. Now you can stay right here and just kind of push your hips back, or you can start to lower down a little closer to the ground. And this is where a block can come in handy because we want to get to a point where we can rest our forehead on our block, or maybe a cushion or a pillow. And then just keep kind of reaching over to your left as you work on lengthening out your right side body. Very nice. And now we're going to take our child's reach over to the other side. Walk all the way over to our right, as far as you can. Hips press back toward your heels. Maybe your forehead comes to the block or the ground. It really kind of just depends at this point how far along in your pregnancy you are, how big your belly is, how much room or space you have. And you can even bring a pillow or a cushion all the way in between your legs and rest your belly and your head on it if that's comfortable. Very nice. And now let's slowly walk ourselves up and back to the center. And now we're going to move into our shoulders. So we'll keep our block, or whatever you have that's representative of a block right now. It could be a rolled towel, so if you have a rolled beach towel, you can sit on that too. I like to sit on something when we're doing shoulder work because it helps to lengthen this area of our spine right here. And when we're pregnant, our bellies kind of tend to bring our hips forward, that pelvic tilt kind of comes into play. And this just kind of helps neutralize the pelvis and reduce that really significant pelvic tilt and put our spine in just a little bit of a more ideal alignment so we can really focus on our shoulders. So for our shoulders, we're going to have our strap or scarf or belt handy. We're going to keep it right here. We're going to start by just rolling one shoulder up toward the ear and then press it back and just keep that circle flowing. So we're working on warming up the shoulder joint of our right side. Very nice. And then reverse. So it looks kind of like this. And I know it looks silly, and that's okay. We're working on warming up the shoulder, warming up our necks too, because shoulders and necks are really very intimately tied. And then let's do the other side. So there's a big meaty muscle here called your trapezius. And sometimes when that trapezius is tight, we feel it in our neck, but sometimes we feel it in our shoulder. Sometimes we feel it in both. So we really want to work on rolling this out, reverse the direction, opposite way, so we don't feel that trapezius tension that causes neck pain and shoulder pain and all sorts of aches and pains. Very good. All right, so next we're going for our shoulder strap circles. So now that our shoulders are a little warm, we're going to grab our strap, and I'm actually going to come off my block for this just so you can see me a little better. You can stay on your block. We're taking the strap in our hands and we're going to slide our arms out pretty wide and bring them up to a V. Now notice right away my wrists are what I call broken wrists. So they're kind of like bent inward. You want to work on just boop, clicking them up. See how they're bent inwards? But then I put them in line with my elbows and my shoulders. So those are strong wrists, and that's what we want here. So as you have your baby postpartum, you might experience something called mother's thumb. I've heard it called mother's wrist, and it has an actual name, and I can't recall it at the moment, but it's where our ligament in this area of our body kind of gets overextended from picking our babies up like this all the time, and we want to work on picking our babies up with flat hands. That can be tricky, especially when they're limp little noodle newborns. So this is an exercise that helps keep our wrist joints functioning strong. When we actively put them from this position to that position, you're working on strengthening the little muscles in your wrists, and we're also working on that mobility of our shoulder joints. So notice how I have a little bend in my elbows as I roll the strap behind my head. Now you might want to come back up like so. You may find that it feels like a really nice stretch in your chest and you want to keep rotating backward. If at any point it causes you pain, tingling, numbness, come back up over your head, slide your hands back out, and try for a wider grip. And then we'll just kind of do that, I'd say anywhere between 5 to 10 times. If you're really enjoying it, you can go all the way down and then come all the way back up. If you feel at a certain point you need a little more, you can bring your hands closer together on the strap, a little more of a stretch as your shoulders and chest muscles and upper back muscles warm up. You might, but remember, be very aware of your shoulders and do not let them feel pain, tingling, or numbness at any point. Very nice. All right, so we have 2 more. We have our platter servers. And so this is where we take our block or a book, we place it in our right palm. And we're going to circle around our back and up over our head. Very good. And then bring it forward like you're serving somebody a platter of beautiful chocolates. And then we bring it up, circle, rotate back. So now our thumb is pointing forward and overhead. And then we bring it back around. Very good. Circle, bring it back, overhead, and last time. Very good. So other hand, we circle, rotate thumb back, and now thumb is pointing forward. And then bring it back down, ooh, and around. Very good. And this is kind of fun. Sometimes the block slides out of the hand. That's fine. And one more time. Very good. Okay, very last for our shoulders is our cactus pulls. So in our cactus pulls, you can do this seated in a chair. You can stay seated crisscross applesauce. You can stay seated on a block, or you can come to seated on the knees if that's something that's comfortable for you. I'm going to turn around so you can see this movement in my back. These cactus pulls, arms are like a cactus, right? Like a big saguaro cactus. And we're going to work on bringing our elbows back behind our back. So as if we wanted our elbows to touch, but careful here. When we do that, we kind of notice how I do a little rib flare. We want to work on keeping baby hugged in toward midsection or toward spine. So we want to try and avoid doing that little pop action, that little rib flare. So we're going to work on bringing elbows back behind body. And that might mean they don't come as close together, because notice when I bring them a little closer together, that's when I get that little pop, and we don't want that. So we're going to work on cactus arms. Exhale, elbows come back, and that's about my stopping point right before my rib flare. Inhale up. Exhale, elbows together behind your back. Let's do 3 more. Inhale up. Exhale. 2, 3. Very nice. Beautiful job. All right. That's it for shoulders. We're going to move into our thoracic spine. So standing twists or seated twists, if you would prefer. Standing twists or seated twists are just what they sound like. So I'll do it in the chair. So with our seated twists, we're going to bring our knees out nice and wide, toes turned out, and I have my legs nice and open here. Now, I would recommend using a block to start, just to see what your flexibility in this thoracic spine feels like. We're going to bring our left palm down onto the block, right under our body. So I'm gonna have to scoot that out a little more so I have that nice line. And then our right arm is going to twist up toward the sky. There's a big opening along your right side. And if you choose to do this standing, you'll just come up into a standing posture with your feet about 2.5 to 3 feet apart. And you can bring your hand to the block and do the same movement, but standing instead of seated. And we'll hold for 3 breaths. And that's probably our 3rd breath. And then we're going to close the palm down like we're closing a book, and we're going to open it up. 1, 2, 3. Very nice. And then right palm replaces the left. Left arm opens up for 3 breaths. In through nose, out through mouth, in, out, in, out, and 3 closes. So slowly close it down, open, close, open, close, open. Very nice. Hand comes down to the block, elbows and forearms come to your thighs, and then hug your baby into your tummy and slowly come up. Hugging baby into tummy helps to keep our low back and mid back protected so we're not straining those back muscles to rise up. All right, so we have just a couple more movements before we move over to our pelvis. This is a seated movement, and it's kind of like a little bit of a back extension. We're gonna put both of our hands on our heart here, and we're focusing on, now we're gonna really find that rib flare that I was asking you to avoid earlier, and we're gonna follow it with a round of the back. So you almost look like a butterfly here. As you come forward, you C-curl your back, and as you move back, you really arch your back and you press your heart into your hands. All right, now we're really working this thoracic area of our spine. We're really asking those muscles and those joints to work together in harmony. And you might find, ooh, my heart rate's accelerating a little bit. So that's why we kind of do this slower, not fast. And your heart rate will accelerate a little bit. If you start to get really short of breath or you feel faint or dizzy, stop. Let's do 2 more. Very nice. All right, moving on to our pelvis. We are going to do a couple of movements followed by a pelvic floor exercise that we're going to explore more in trimester 3, but I'd like to introduce it here in trimester 2 mobility practice. So for this particular movement, you can do them either in your chair, seated in your bed, seated against a wall, or if you're feeling comfortable, you can do it seated in the middle of the floor. So we're going to be doing seated knee to armpit. So with this one, you can just let your right leg come out in front of you for a little bit of grounding to keep your foundation or your base strong. And you're gonna bring your knee to your armpit and then let it come out. Knee to armpit, let it come out. Good. Now here, you can also find a little bit of an extension or bring your hand under your thigh and do this. Now, when you bring your leg out, flex your foot, knee to chest or armpit, flex your foot and extend. And hey, this movement might be really small, so you might be doing this, right? Some people have real flexible hips and can draw those knees up toward that space of their underarm, even with a beautiful baby bump hanging out there in space. And some people have more limited mobility in those hip joints. Lots of factors come into play for this. Wherever you are is right where you need to be. And this is one of the reasons we do hip mobility. Very good. This is also called a sciatic nerve glide. So if you're having sciatic type issues, this can be very helpful for that. Very good. Now let's do the other side. So leg comes out to support you. Fingers under arms under knee or on top of knee. Knee toward armpit, extend and flex. Knee to armpit, extend and flex. So we did 10 on the other side. So make sure you do 10 on this side. nice. We're almost done. We have 2 more exercises and that completes our practice today. Very good. All right, so the pelvic exercise that I was telling you about, this is where we're going to need our rolled hand towel, because we are going to place this. You have 2 options for seats here. You can sit on your knees and place the rolled hand towel under your pelvic floor, or if that's not comfortable, you sit in the chair and do the same thing. Rolled hand towel goes right under your pelvic floor, like so. And we're going to be bringing a hand to our heart and a hand to our real low belly, just above our pubic bone here, and feet come out. And so with the purpose of this exercise, we're going to try and notice how much we feel our pelvic floor move as we breathe. So we're going to inhale, big breath, and then as we exhale, we're going to pull our baby, our belly in toward our spine, and also contract and lift our pelvic floor. Inhale, let your whole belly and rib cage expand, and exhale, belly and pelvic floor pull in. Inhale, expand. Exhale, belly and pelvic floor pull in and up. Inhale, soften everything and expand. Soften pelvic floor, release pelvic floor. Let belly expand. Exhale, in and up. 2 more times. Inhale, expand. Exhale, in and up. Inhale, expand. Exhale, in and up. Very nice. All right. So for this one last pelvic floor exercise, some people are like, isn't that just a Kegel? And it's very similar to a Kegel movement. If you find pain, discomfort, achiness after you do those pelvic floor contractions, please discontinue and make an appointment with a pelvic floor PT. So for this last pelvic exercise, we're going to try and hold it for a count of 10 seconds. If you can't make it 10 seconds, no worries. We're going to inhale. Let's bring our hands to our belly here. Inhale and let your belly expand. And exhale, draw your baby in. Lift, contract your pelvic floor and squeeze it for 9, 8, 7, 6, 5, 4, 3, 2, 1. And release, very good. And so we want to keep our breath flowing steadily through that lift and hold. A lot of times I notice people will hold their breaths as they're doing that countdown, but you want to hold the movement, but keep your breath going. So it takes some time to practice, but we will get there. And then the very last stretch that we're going to do for our pelvic floor is a seated happy baby. So for seated happy baby, you can also do this in the chair on your bed. Right hand comes behind you, right leg is just tucked in. We're gonna grab either the outer or the inner edge of your left foot, whatever's easier for your shoulder joint. And then we're going to bend our knee and we're just gonna pull it in toward our backside. Good, and if you prefer, you can do just like little extensions and pullbacks. You can hold it. If you're still comfortable on your back, you can do full happy baby on your back. A lot of people will say, but I was told not to lie on my back during pregnancy. Not for extended periods of time, I wouldn't, but for the 1 to 2 minutes that you're doing happy baby, you will be all right. If you are concerned about being on your back, you can also roll up a yoga mat and place it under your spine so your spine's at a little bit of an elevation. And that takes all the concern out of doing that posture on your back for the very short amount of time that you're going to be doing it. Finishing after your happy baby with a nice long child's posture. This is one that I suggest doing with lots of pillows. You can stack up a bunch of pillows here or grab a bolster or a really firm couch cushion, make a little space for your baby belly, and then just fold down over your props and in your mobility practice with a nice wide-kneed child's posture for a great pelvic floor stretch. All right, we'll see you over in your 3rd trimester mobility practice next. Bye.